Good afternoon. I'm really impressed by all the e-patients sharing their stories, and I really want to thank Nikki and Emily for getting up here and talking about their own experiences. And at the end of the day, that's what it's all about. I'm Teresa Zayas Caban. I work with the Agency for Healthcare Research and Quality, and I'll be talking briefly about the agency, the health IT program, some of our funding opportunities, and areas of interest. And for those who haven't received funding or are thinking about applying for funding, how to get started. So AHRQ is one of the agencies that's part of the U.S. Department of Health and Human Services. We are a research funding agency. Our focus is really on health services research or the healthcare delivery system. The mission of the agency is to improve quality, safety, efficiency, and effectiveness of healthcare for all Americans. And compared to other agencies that work in health IT space, we're really interested in building the evidence on healthcare quality, whereas, for example, ONC really coordinates health IT policy and programs, and CMS sets rules for payments. Compared to other research funding agencies in Health and Human Services, for example, NIH is really focused on basic biomedical research, CDC on population health, whereas our focus is really on how care is delivered, where the rubber meets the road. As I said, I work with the Health Information Technology portfolio. We're really interested in building the evidence base on how health IT can be used to deliver high-quality care and developing evidence-based tools to help others do the same. Our three sort of strategies for doing that are stated on this slide. The portfolio has been in existence formally since 2004, even though the agency has been funding informatics research for over 20 years. So let's talk briefly about health IT. So broadly speaking, when we talk about health IT at AHRQ, and I realize this may vary from agency to agency, we talk about the use of information and communication technology to support the delivery of patient or population care, or support patient self-management, or both. So the bottom line is really the focus is on direct patient care activities. And I highlight this only because we always get grant applications for people who are interested in developing billing systems, and that's not what we're about. We're more about the interaction with the patient and delivering that care. In terms of IT, something to clarify is that we're really interested in systems that have some information system or processing behind them. So not just use of the technology. So as much as you'd be interested in doing this work, if you're interested in robotic surgery, just videos, or just medical devices, glucometers, surgical equipment, instrumentation, it's not a good fit with what we're doing at AHRQ, but we're happy to direct you to other sources of funding. Now, a word about funding. Something that not a lot of people know or understand is that the agency actually uses both research grants and contracts. And the difference really is in terms of the ask for applicants, or those submitting proposals, and as well as how structured the project will be. The portfolio's budget has been, up until recently, about half and half going to grants and half to research contracts. And I would say that for folks who have not been as involved in the research community and health IT or health services research in general, contracts may be a good mechanism to get started because there are established mechanisms with institutions that have partnerships, both with healthcare provider organizations, practice-based research networks, which Jolt alluded to in our session earlier this morning, as well as academic medical centers and other institutions that you can find a way into to partner to do research, focus on health IT as well as other topics of relevance to the agency. The health IT portfolio has several ongoing grant funding opportunities, and these vary in size. We use the NIH system as well as the NIH funding opportunity types, and this is an alphabet soup of mechanisms that I'm not going to bore you with, but just to give you a flavor, we do have a funding opportunity for small projects, really pilot studies. If you're trying to do a needs assessment, you have an idea for a system that you like to test out. If you want to develop a new survey related to health IT use, for example, this would be a great fit. As well as if you already concluded a health IT research study, you have a data set that you like to do some secondary data analysis on, Or a specific area where there's a huge gap actually in the field is looking at the economic impact or doing economic analysis of health IT interventions. We also have an exploratory grant mechanism for larger feasibility studies where you have an health IT intervention and you like to do some testing before you do something like an experiment with a broader population or a randomized clinical trial. As a program, we've been interested in also helping train the next generation of researchers, and so we've had a special emphasis notice going on for several years now, which was recently reissued for folks who are interested in doing dissertations in health IT or who would like to be funded through what's known as a Career Development Award. In addition, we have two R01 mechanisms. These are larger research grant programs. Projects can go for up to 5 years. One in understanding clinical information needs, and the other one in understanding user needs and context. So something I wanted to highlight across our mechanisms is that we have two, the small study and the R21, the exploratory pilot feasibility study, that call out specifically patient-centered care as an area of interest that folks can apply to. And it's been a priority for the portfolio for several years now. In addition, the understanding user needs FOA is one that's sort of near and dear to my heart. We really wanted to take a step back and think about what are individuals' health information management practices, what are their health information management needs, and what does that mean for the design of consumer health IT applications? How do we build tools that actually address those needs so that they're used and they're also effective in improving quality of care? In addition, we also fund some grants that come in through what's known as agency-wide funding opportunities, which include also demonstration projects and investigator-initiated research opportunities. In terms of areas of interest, I would say that health IT is a means to an end. At the end of the day, the goal is really to deliver better care. But at the same time, there are some basic health IT research needs and research gaps that need to be addressed. And we see health IT as a tool that should be implemented as part of practice redesign effort, as part of a coordinated quality improvement effort, where you think about what it is, what are the goals you want to reach, where is it you want to improve quality, and where can health IT help you achieve that. And so as such, we have some areas of interest that are in our most recent special emphasis notice that really focus on the entire quality improvement cycle or the development cycle of health IT. So we really want to cover the gamut and understand how do we design applications to be more effective? What are users' needs when you develop these applications? How do we implement these so they are most effective? What are considerations for best implementation practices? What happens once health IT systems are in place? How do they get used? What does that mean for the design or the implementation process? What is the actual impact of these interventions on outcomes? And as well as how can health IT be used to support quality measurement, to feed into this larger quality improvement cycle. In terms of impact of outcomes, we're really trying to align with the national quality strategy. So we're talking about, does it improve patient safety? Does it address patient-centered care? Does it support better communication, care coordination, and team-based care? Is it focused on prevention and treatment for the leading causes of mortality? Does it impact work with communities? Or will it make quality of care more affordable? Now, in terms of getting started, if you've never received funding for research on health IT and you'd like to submit an application, the first recommendation I'd make is just go to our website, see what others have done, what they've gotten funded for, at what scale, as well as look at the field, understand what's been accomplished, what do the findings say, what does the literature say? And that'll help you find research gaps, because at the end of the day, we're really interested in filling those gaps in terms of understanding how health IT can improve quality. Start with smaller projects. An R03, for example, would be a good mechanism for somebody who hasn't been funded before, a pilot study. And it's a good way to get started. Those are about $100,000 over 2 years. Collaborate with established researchers. Really, at meetings like this and others, just network and find people who are working in that space and who you'd be able to contribute to a project and set something up together. And that way you can gain experience until you can come in as a principal investigator or project director on your own project. And honestly, just contact us. If you have an idea for a project, just send an email, and we'll be happy to guide you, tell you whether it's a fit with our priorities or fit with our funding opportunities, and what mechanisms to consider to make sure you're successful. And that's it. Thank you.